If you stopped your cancer treatment because it wasn't working, I want you to know something important. This is not the end of your story. You're not out of options and you're not alone. We've walked with thousands of patients, and I've seen this in clinical experience, standing on those crossroads, feeling unsure of what the next step is, what to do, worried about where they're going to go, how they can be helped. And I've seen this path move forward in a very positive way once people get the right information. So it's so important that when you reach this point, it's usually after months or years of doing everything your doctors told you. You've done the right chemotherapy, the radiation, you've already done other integrative natural treatments, you've taken the other medicines and maybe other targeted drugs, quote unquote, but the results aren't what you hope for. It's exhausting and it can get you disoriented. And this is where fear can take over. Fear tells you there's nothing else, but the truth is there are lots of options. And the key is knowing how to find the right ones for your cancer, your precision medicines that you need. This is the key. So when treatment fails, you don't have to do experimentally blind, trying this and that. You need something that builds the custom plan for you, that looks at your exact genomics, transcriptomics, NGS, immune profiling, spatial biology. All these gives us thousands of data points. So we know what your situation is. So when we see patients, it's very common that 90% of all the patients we see were on the wrong chemotherapies. They were on the wrong natural integrative agents when we test. That's why the testing is just so important. So now we can combine the exact best of all the care, on, off-label, integrative, all the right treatments that are customized just for you. We're not talking about trial and error method here. We're talking about mapping out cancer's unique targets using 1,000+ data points that go way beyond maybe the 20, 24 you get from a standard hospital and cancer center, biopsy, tumor markers, imaging. This goes way beyond that. And this approach reveals the options other doctors never discuss with you because they don't have access to it, or simply because they didn't have the full map in front of them. I know many people, that are going through this don't know where to go and what to do. The key here is getting the care you need. And that often involves understanding the care, the testing, the cost, the travel involved. And we can guide you through that. We published it in 2024. We had 35 times better outcomes in late-stage cancer than conventional care, and 43 times quality of life. Imagine the sooner we see the patient, the better. From these data points, from precision oncology, using precision targeting. This has been our clinical experience. And we're here to help you. We help people so often they don't lose hair. They have color in their face. They don't look like cancer patients. And their targeting is specific. We can get to the tumors using innovative technologies, break some of the barriers that are there so that we can help them to respond. You might be surprised on how many patients we've helped over the years that were told there wasn't a clear path or nothing that they could do. But it's been this work and this mission of us uncovering these key targets that I have seen work. And I see the end of cancer coming because as these targets become more and more treatable with the work we're doing, we're seeing just better and better results. So I think one of the patients who they were told there were no more good options to go home, put their affairs in order. They came in from Texas, one of the top cancer hospitals there. You would know the name of them, and they were sent home. They were in their 70s. They had nothing to do. Go home, get your affairs in order. We just did testing. We literally did about a month of care with targeted care, and the patient's in remission and is going to live out their life. In that particular story, that's a good example. Not everybody's that easy, but that was an example of something where when you have targeting, you can uncover the right treatment. You don't have to guess anymore. This is the future of oncology, and this is what we do, and this is how we help patients. This is what I see is the way of care and making the difference for people. So if you have any questions, you're in that crossroads, you don't know what treatment to do, what the next steps are, you don't have to do this alone. You can reach out. We're here to help you. Hope this was helpful, and may the Lord bless you on your journey to healing.